come on in. We're glad to have with us today Holly May and Josie McDaniel Burkett. Nice to see you again. Okay. Chaplain Darling, if you please.
Yes, sir. During a time of anxiety and deep-seated fear and challenges, we come today after a weekend where we celebrated, of course, Easter and, of course, even the Exodus, a high day for Jews and a high day for Christians. So we believe that suffering is a part of life, but trouble doesn't last always. Let us pray, you and your tradition and me and mine. Lord of all mercy and compassion, we come today, knowing that you're God and beside you there is no other. We pray that you have mercy for those who have suffered loss, for those who have experienced the ravaging and hurting power of COVID-19. We know that you are able to do anything but fail. We say, Lord, have mercy. Touch those that are wrestling with this thing, whose grip we found ourselves in. And we know that you're able to deliver and to set us free. So right now, we believe and we pray that the wisdom of leadership, those that are making those decisions that really affect all of our lives, will change everything that we're going through now. And we expect it because the same power that raised you up on that Easter Sunday morning, the same power that brought Israel out of bondage, that same power can deliver us even now. We thank you for healing and deliverance. In your name we pray. Amen.
Amen. Thank you. And thank you, all of you, for coming to help us participate in getting the information and out to the people of the state so they'll know what's happening in these government circles and have information on which to base their decisions. We have a new disaster on our hands now, of course, with the tornado. As you know, it came through last night. It varied in time somewhere between 4 or 5 o'clock in the morning, or maybe a little earlier on through past daylight, and did a whole lot of damage. And several of us went up to Seneca today to look at it there. They also had damage in the neighboring counties, as well as around Orangeburg and as well as around Hampton. And it is quite something to see. The destruction is enormous. The trees broken off, big pine trees halfway up with no limbs on them, and the top's gone somewhere. Big oak trees ripped up, houses smashed, everything smashed but the spirit of the people in Seneca. It's quite a sight to see. So, Chaplain, we have another group that we can begin praying for as well. Keep them in our prayers as well, because they're nine of our fellow South Carolinians lost their lives, and I hope that's all. But we are assessing the financial impact, the damage, for two purposes. One is for an emergency, state of emergency declaration in the state, and also to submit information about the financial damage and personal consequences, both to government buildings, infrastructure, as well as to homes, to the federal government for disaster declaration there and all that those things entail. But I wish you could have seen the spirit of the people in Seneca. There were trees lying all over the place and houses knocked down and some gone, and cars, trucks turned end on end, and the roof and parts of the Borg Warner factory up there, which is huge, was just all over Seneca. It was quite a sight. I don't know if I've ever seen anything quite like it, and I've seen a lot of hurricanes and a few tornadoes, but this is really something. And the damage was also horrendous in Orangeburg and those counties there, and in Hampton and Colleton and in that area as well, and Berkeley, I believe, too. So we pray for those and families who are lost their loved ones, but let's go forward strongly and continue on as we have been. In the last 4 weeks, we have lost a lot of jobs in South Carolina. The market sources coming into some of our businesses have disappeared, and they have had to close. The customers have dried up, and that has affected other businesses. And of course, there are some that we consider to be the best place to the businesses that we unfortunately decided must be closed in order to protect the public. And we've got over 260,000 people, at least that many, that as a result of all these things have lost their jobs. And the federal resources are just becoming available. The $600 that has been mentioned time and time again, that'll be supplement unemployment, ought to be in people's bank accounts or debit cards soon, if not already. But that's the beginning of that. And if I would urge everyone to go to the websites, all of them are tied in together, and find a way, if you're covered by any of those programs, and there are a lot of them, to find a way to get some resources to help you get through. But the main thing, what we hope that we can do, is we can get our economy started back again, get this economic engine going. We've tried to, and are still trying, and trying with great determination and deliberation to do as much damage as we can to the virus and to stop it without stopping businesses and pushing them underwater and into bankruptcy. Every business is essential to somebody, particularly the one working there. And so what might be essential to you might not be essential to him or her. But we want to get all these businesses going back as soon as we can. And to that end, we will be announcing before long a plan, a rejuvenation a plan, a revitalization plan, in order to get our economy started again. But now I can tell you that we've made a lot of progress. Our hospitals, the healthcare providers have stood up in great strength. We are prepared for the worst. We're working hard. The compliance has been good across the board in all the things that we've asked people to do, but now's not the time to let up. We have to keep on going and keep working and working together and following the advice and recommendations that come from the official sources. And I believe that we'll make great progress, and we'll come out of this very well. So with that, Dr. Traxler.
Thank you, Governor. Good afternoon. Today we are reporting 127 new cases of COVID-19 in South Carolina, which brings the total number of people who have tested positive for the disease in our state to 3,439. Unfortunately, we also report 5 additional deaths, bringing our total number of deaths of those who have tested positive for COVID-19 to 87. Let's continue to remember that these are not just numbers. They are people. None of us is immune to this disease, and there currently is no vaccine. The virus is widespread in our state and in our communities. Half of the counties in South Carolina have experienced 1 or more deaths among its residents. To support anticipated increases of people confirmed to have COVID-19, we continue to work with our partners, such as EMD and healthcare facilities, to stay updated on the availability of acute care beds throughout the state. As of yesterday, we are at approximately 51% capacity, with 5,748 beds available. A total of 32,764 tests have been run by DHEC's Public Health Laboratory and private labs in our state. This means that approximately 10% of tests from South Carolina residents have been positive for COVID-19. Protect yourself and others from this disease. People in our communities are getting sick and even dying of this. People 65 years and older, and those with conditions such as diabetes, high blood pressure, and heart disease are at the greatest risk. Help stop the spread of COVID-19 by staying home as much as possible, avoiding close contact with others, washing your hands frequently, and continuing to take your prescribed medications. For the latest information, you can visit our website, which is scdhec.gov/COVID-19. Thank you.
Thank you. Mr. Okowski. Yes, sir.
My name is Richard Kolsky. I'm the meteorologist in charge of the National Weather Service office in Columbia. And unfortunately, we had the most significant severe weather outbreak in South Carolina since March of 2008. In fact, this was the most significant U.S. Severe weather outbreak since March 2012. The front that came through, it started in Louisiana on Easter morning and then moved to the South Carolina coast by late this morning. We had multiple long track strong, which is EF2 damage or greater tornadoes move across the state from about 4 a.m. to 10 a.m. this morning. Some of the survey work, this information is coming in as we speak. It completed in Barnwell, Orangeburg, and Calhoun counties. The worst damage we've seen is EF3 damage so far, 140 miles per hour. Additional survey work will be required tomorrow along this track, particularly in Aiken County. Surveyors reported EF0 damage along a 7.4-mile track in Pickens County. And then we have survey teams continuing to work in Hampton, Berkeley, and Dorchester counties. More surveying is required also from Edisto Beach to Kiowa Island. We have ongoing surveys in Georgetown, South Carolina, with a preliminary rating of EF1 damage west of downtown Georgetown. Another tornado is possible near Litchfield Beach, and more survey work required as well in Horry and Marlborough counties. The governor mentioned Seneca. The Westminster to Seneca track, the damage so far is EF3 damage. I don't have a maximum wind speed. Warehouses and numerous homes were damaged. Then also in northern Pickens to Greenville County, a track with EF2 damage with 120 miles per hour maximum winds with several mobile homes destroyed. There will be more damage surveys which will take place tomorrow and probably into Wednesday. And some things to consider with this event, with this outbreak, is it could have been far worse if that front had gone through in the afternoon hours of peak heating versus the early morning hours. It was bad enough. And, it's going to take some time to go through and get a final report for the state in terms of any disaster declarations. It's tedious work. These tracks, some of them are 30 to 50 miles long. This is a very rare situation that I've only faced working in different parts of the country several times in my career, and I'm grateful that the damage so far, it's bad, but it could have been far worse. Thank you, Governor.
Thanks, sir. Dr. Stinson.
All right, Kim Stinson from State Emergency Management. We'll talk first a little bit about the severe weather and then follow up with some COVID-19 information. But this has definitely been a statewide event, and most counties have reported some level of damage. Of course, some worse than others, but we've got damage assessments that are ongoing and don't have a lot of really good figures right now, but we hope to certainly later tonight and in the morning. But the hardest hit areas right now include Aiken, Berkeley, Colleton, Hampton, Oconee, Orangeburg, and Pickens counties, who have reported multiple homes either damaged or destroyed. As the governor mentioned, there were unfortunately nine fatalities that have been reported. There was 5 in Hampton County, 2 in Orangeburg County, 1 in Oconee County, and 1 in Colleton County. And this number may increase as access right now is still somewhat limited in some of those areas that were hardest hit. So we'll continue to look at that number. Peak power outages for this event was around 290,000 customers. And it's currently, when I walked in here, it's less than 90,000 total customers right now that are out of power. So they made considerable progress throughout the day. And then state assistance for this operation has included damage assessment flyovers in Oconee and Orangeburg, chainsaw teams to Pickens and Oconee, deployed also an incident management team to Seneca, and we've got numerous state agencies that are responding under their normal authorities, including SLED, DNR, and others. It's really kind of too early in the damage assessment process to determine if we might be eligible for any federal assistance, but we'll continue working with the local authorities, today, tonight, and certainly tomorrow in analyzing and finalizing that data. Would remind all our citizens, and about 190,000 of them already done it, signed up for our South Carolina Emergency Manager app, which you can download at Google Play or at the Apple Store. And basically, it's got a lot of good information in there to how to stay prepared, plan. It's a mobile device, so you can take it with you, obviously, anywhere you need to go. But in particular, I want to mention that there's a damage assessment section in there. There's a module in there under the tools section that allows you to submit a damage assessment and then forward that to us, and then we get it back out to the counties, and we'll use that as another way of tracking damage. Because you can imagine, talked about already the National Weather Service in terms of the length of the tornadoes and the area it actually covers in some of the counties. Certainly a lot of area to cover. So if citizens could download that app, they can use it in the future for hurricanes and everything else. But at this time, in particular, the damage assessment piece of it. And then the last thing I wanted to mention is that South Carolina has activated our donated goods system for COVID-19, similar to what we do during hurricanes and floods. And we have a system to manage that. And currently, we're looking for donations of personal protective equipment to safeguard healthcare professionals and first responders. And that specific needs include gloves, gowns, face shields, N95 respirator masks, and hand sanitizer. And those donations can be coordinated by calling the following number. That's 803-737-8518. That's 803-737-8518. And there's also a link on our webpage, too, if you want some more information in terms of that. And our webpage is at scemd.org. Thank you, sir.
Thanks, sir. Secretary Hall.
Good afternoon. I'm Secretary Hall with the Department of Transportation. Just wanted to give you a quick update on the status of the roads in the state. When the storm moved through the state this morning, we had roughly about 2,500 trees that came down across the roads. That included across portions of I-26 near Volvo, as well as I-95 in Colleton County at around mile marker 55. Our crews, which are approximately about 2,000 employees, paired up with first responders, fire department, local government officials, and our power companies to push really hard today to get most of those roads reopened. About 30% of those roads or those closures involve trees tangled up in power lines. So I want to say thank you to the power companies for pairing up with our teams to get those to get that remedied going forward. We estimate that roughly about 70% of all the roads will be reopened today, with about 30% carrying over into tomorrow as we move crews into some of these more harder hit areas. Hampton County in particular is one of the areas that we're moving crews, additional road crews into from adjacent counties in order to try to get those roads reopened as quickly as possible. One last thing, if I may, just encourage, if you're out on the roads, traveling throughout the state, please travel with caution. There's still a lot of debris on the side of the roads, and as I mentioned, about 30% of the roads that we had closed earlier in the day, we're still working to get cleared and operational. So thank you for your patience, Governor.
Thank you, ma'am. Are there any questions for anyone? Yes, ma'am.
Yes, so does this require a separate emergency declaration?
Yes.
Okay. And how many tornadoes touched down? Do we have a count?
Do we have a count at this time? Could you hear? We don't have an accurate count, but there are a lot of them. Must have been because they tore these places up. Next question.
Governor, I know a lot of people, you were mentioning that people should go online and try to access those resources if they need to file for unemployment or need help with that, but we're hearing from a lot of people that the site is still not working for them, they're not hearing back. What do you say to those folks?
Well, we were slowed down. This has been unprecedented. I mean, they have thousands, hundreds of thousands of these calls all coming in at the same time. And all of these unemployment calls that are coming in to the Department of Employment and Workforce must be routed first as people go online through the Social Security computers in Maryland or Washington. And if they are not working, which they've been slow to work, that slows down the whole process. But we've been working with them. We think they've fixed those. We've added on at Department of Employment Workforce every asset that we could bring in this unprecedented onslaught of claims to handle them, and we think we have a handle on it now, but we're still bringing in more people. I'd ask people just to have patience. Anything that they are entitled to under the law will be given to them, and it'll be retroactive from the very beginning. For instance, the $600 a week that lasts for a certain period of time. Even if you don't get it your first week, you will get it eventually. And we hope to have that flowing, because there are a lot of people out of work. And this is a crushing thing, not only to those people and their families, but to business in South Carolina. And you know, we've been breaking records in business and growth in South Carolina. And we got to get back to that, but we want to be sure to keep the people healthy. And that's why I'm glad to say that we're seeing compliance, a lot of real good compliance with these orders and recommendations that we've made. Yes, ma'am.
Governor, you said that you'll be giving more information to come about a plan to get the state going
Yes, ma'am.
again. And obviously, I know that's something that you all are working on big time. But the president today said that it's going to be up to him and not governors like you to figure out when the country is going to start getting back to business. You're a longtime ally of the president. What do you say to a statement like that?
I don't know what he said, but I know I've talked to him face to face, and the vice president. The vice president's been here. We've been on the phone, been on video conferences right here in this building numerous times, and I know that the president and his administration control a lot of resources. We know that from FEMA and everything else involved, and you've seen it all on television. But he's made it clear that he's relying on the governors and the local authorities to give him the information that he needs to make his decisions. We're working very closely with him in this, and he sees a way out of this. I think we all see and are looking for a way to keep the people safe, but not kill all these businesses, all these hopes for the future for all our people all over the country. So we're working. This has really been a grand collaboration and cooperation with the Trump administration. Yes,
Are you confident?
Are you getting any pressure from?
I'll come back.
Are you getting any pressure from the president to reopen as sooner rather than later?
No, sir. He's not been given any pressure. He's asking for information. That's what we do on these calls that we have. The people that you see on television at the press conferences are sitting around a table like this one, and they're presenting information to us, and the governors are responding back to the president and to those people that you see. Yes, ma'am.
But are you confident, though, that you're going to be able to be on the same page as
Yes,
the
ma'am.
president? Because he said today that it's fake news for people to be reporting that it is going to be happening just at the state level,
Well,
that he's going to be the one to make it happen and to decide.
I count on what he has told us and me and others face to face, and that is we're working together to see that the people of this country are kept as safe as possible from this horrendous virus that none of us have ever seen before. It's totally unprecedented. And the response that is coming from Washington at the will of the president is also unprecedented in the history of this country. And this is the tightest, most forceful collaboration between the governors and the president that I've ever seen, because it's daily. Yes, ma'am.
For those
Sean?
displaced today, either because their house is damaged, destroyed, or they just lack power, how does that fit with the guidelines of COVID-19? Should they resist or not go with family and friends to prevent the spread, or even volunteers? Should people not volunteer to help them out?
The virus is still there, and it's not gone away. Despite all this, it doesn't care if the trees are knocked down or the power's off at all. It doesn't make any difference to the virus. So we must still protect ourselves, still keep that distance as much as possible. Even the workers that we saw in Seneca, they were working, but they weren't. They were trying to stay apart. So that advice, those recommendations are good, and they still count.
Do you have a count of how many people were displaced by the storms?
I do not know. We could. You have an idea?
I don't have any specific figures, but we don't think at this point it's horrendous in terms of sheltering or finding hotels for anybody. Primarily, they'll probably, as you mentioned, seek shelter with friends and family. But there's probably a significant number that'll do that. But as far as sheltering in hotels, probably not that many.
And no need to open up like schools or anything like that for
No,
shelters?
and basically the way the Red Cross is going to handle it this time is that they're going to primarily put people up in hotels as opposed to congregate shelters.
While you're
Yes,
up there,
ma'am.
sir, actually, how about those power outages? Any idea when everybody can see their power back up? Any estimate?
Well, the Office of Regulatory Staff, who I just talked to here a few minutes ago, is pretty sure that there probably is 75 to 80% of all the power outages will probably be fixed today, but there'll be some percentage, 10 or 25% or so that may take into tomorrow. They had a lot of transmission lines that actually were destroyed, but they're pretty confident that they can get this done fairly quickly. And that's a pretty big drop from 290 down to about 90,000 in really less than 12 hours.
But you think everybody should be back up by tomorrow or Wednesday?
I wouldn't want to speculate on that on everybody. I'm sure there's going to be some outliers, over the next 24 to 48 hours. But I would just be speculating right now on that.
Thank you.
Governor,
More questions?
Can you give us any details about this rejuvenation plan that you're looking
Not
to?
at this time, other than our purpose is to get advice, information, guidance, not only from best practices and things that other governors and local authorities are doing, and what our people here in business, in industry, in tourism, in the service industries and restaurants, all of those things that have been so heavily impacted. We want to get their advice and guidance as a group and decide what steps we should take and when to take them. But I want to assure the people of South Carolina, our goal is to save lives, but also to save jobs and to save families and save the futures that are depending on these businesses that are so heavily hit and impacted by this virus. I mean, we have to have a state to go back to where people can freely and happily work and go to school and go to college and all of those kind of things and work for their careers and raise their children. We have to have that to go back to when we defeat this. The virus is going to go away. We have to have an infrastructure and economy to go back to. Yes, ma'am.
Governor, you said earlier every business is essential to somebody.
That's right.
Which I think any business person and just about anybody would agree with. We've been hearing, I think I speak for all the media, we've been hearing a lot of questions and concerns from people kind of confused as to what's essential and what's not. Now the listing of the businesses that have gotten clarifications from Commerce is online, so people can go and see for themselves. But what do you make of a person who comes to us with a question saying, why can't I go and get my dog groomed, but I can't go get the haircut that I've been needing for 2 months? Where is that line when something is going to be essential?
See, that was the reason we did our executive order the way we did it. Instead of trying to list everything that was essential and everything that was non-essential, we looked at those businesses where there's close personal contact, like in a barber shop, a beauty parlor, a nail salon, things like that. Looked at places where there were crowds of people bumping together, like in concerts or athletic events. And looked at places where there's a lot of contact of goods and things, like in a shoe store. Like in a clothing store, when you try on clothes and you touch the buttons, you touch the zipper and you put it back on the rack. You try on this pair of shoes, that pair of shoes, you put it back in the box. And people come in after you and they touch. We looked at those things and thought those are the places that are most likely to cause the most contact and the most spread. Those are the ones that we attempted reluctantly, that we closed. Those are the ones. Everything else is still open. If it's open, it's open. And that a business that's open may not be essential to you or me, but might be essential, certainly essential to that business owner who may have spent his or her lifetime building it up the way it is. And after 2 or 3 weeks of being shut down, it might not open back up. So that is why we, in this state and in several others, were very careful to go to the heart of the matter, to destroy that virus, where you might say where it breeds the strongest, and to keep the others, have social distancing and everything else. Tell people to go home, go to work, go home. If you got to buy something necessary for your family, go ahead and then go on home and keep that virus from spreading. And it appears that we're getting a good compliance on that. That's how we did it. And I think that's the best way to do it, because we'll be able to pick back up more quickly, we think, than others, and without doing damage to people's futures and careers. Yes, sir.
I have a question for Dr. Traxler. Can you give us an update a little bit about the curve, the peak, where you guys see things going, if we're tracking in terms of what you guys were expecting at this point and maybe where we're heading?
Sure. So we are seeing, as the governor mentioned, we're seeing evidence that people are doing what they need to be doing, that they are doing these social distancing measures, they're staying home. And so we're seeing that peak, come down some. We're looking at late April, early May still. And so there still is time for people to continue to do these things or to start doing them if they weren't doing them before. But the message really needs to be that we are seeing evidence that it's working. So keep going.
Dr. Traxler, can you describe just what goes into the projections of how many unreported cases there may be? Is it as simple as taking the current number of reported cases and multiplying it by a certain number?
Right. So, and the basics of that are that for every one case, there are believed to be 9 cases. For every one tested and proved positive case, there are 9 others that are undiagnosed, either have not been tested or are asymptomatic. And so that is the mathematical equation basically that's used.
In some of the projections, it doesn't actually equal up to that.
So for some of them, zip codes don't always align with county lines. Some of that may be part of what is being seen. We're using a more sophisticated statistical modeling. Our statisticians are, and so that's why some of them might have changed over the last couple of weeks. It's more accurate and more precise.
And following up, Richland County has a higher amount of case counts and higher projection counts than places like Charleston County or Greenville County. Charleston County is about the same size. Greenville County is even larger. Why does Richland County have higher projections than those 2 other counties?
The projections are based off of how many cases are being seen at the current time. And Richland has the most cases right now. I don't have an answer for you as to why, in particular, there are more cases there versus other counties.
I know that at one of the earlier press conferences, we spoke about the usage of facilities like coliseums, things like that, as health facilities if this were to get much, much worse. What is the expectation now? Are you all expecting to use these hospital tent pop-ups and using these facilities, or are we thinking that we flattened the curve and things are heading in a positive direction?
So I know that EMD, along with DHEC and the governor's office and many of the other entities, have been working with healthcare facilities throughout the state to continuously be monitoring those bed utilization rates. We have seen a good decrease in the bed utilization rates. There's more beds available now than there were a couple of weeks ago. However, we still continue to work to be prepared no matter what might come.
Governor, on this reopening, are you working with some of your fellow governors or states working together on this?
We talk to each other a lot. We have no group put together at this point to do that, but we're always looking for ideas, what they're doing in other states. And I would say for those who want to know which businesses are open and which are closed, just look at the list. There are a list of about 35 different types of businesses, and those are the ones that unfortunately we had to close or limit.
If, God forbid, we have an early hurricane or another storm come through, what will we do in terms of sheltering? Was that Red Cross model in terms of putting people in hotels, or how do we separate people out?
Yeah, that's a good question in terms of how we'd have to do that. And quite frankly, we haven't got to that point where we've developed good plans to do that. But that came up as early on in this process as a potential, because hurricane season does start on the 1st of June. Typically, it doesn't happen here on the 1st of June, but it could happen. And typically, for us, it's like later in the summer, August and September. But that's one of the areas that we're taking a look at right now, and one of the key areas is the sheltering piece, how we would work that piece as well. So it might mean separating some people in shelters in terms of whether they need to be isolated and quarantined and that sort of thing. And we'll probably have a better system once we build out this hospital augmentation plan in terms of some of the folks that have to be isolated and quarantined and put in hotels and in the what we call non-congregate, non-group shelter settings. So there's definitely going to have to be some work done between now and later in hurricane season. But it's on the radar. We just don't have good solutions for it right now.
Governor, what has enforcement looked like so far as your home or work mandate? And as people get more stir crazy, how are law enforcement officials going to make sure that people are still complying? You know, if you're going out, you get stopped by an officer, you could say, oh, I'm going to Walgreens, I'm going to grandma's house. How do you make sure that they're enforcing that?
Well, we have the best law enforcement in the whole country, I think, and they've got a lot of common sense. And if somebody wants to test them, I'm sure they'll find law enforcement equal to the task. But we've tried to make it very clear. That's why we listed those types of business in categories that are easy to understand, because those are the places where most of the kind of physical personal contact or contact offer items takes place. We think that was the right way to address it. Law enforcement has we had some enforcement problems in the beginning on the beaches and the sandbars and so we took care of that with mandates. And if something requires it, then we'll do something else. But we're not expecting the people in South Carolina to try to take advantage of the situation for any reason. We want everybody to use good common sense and be a good neighbor. And if they do that, then we'll get out of this. There's some damage, but we'll get out and we'll fix it and we'll go ahead.
Question for
Yes.
Dr. Toomey. Does DHEC plan to be using the Abbott Laboratories rapid testing that they have been talking about? If so, where?
The question is DHEC planning to use the Abbott rapid test? We have received 15 modules. With those, we received enough test kits or kits for 5 of them. And we're working with the Hospital Association and other partners to identify where we would deploy the 15 kits, and may not be just hospitals, but other strategically located facilities or institutions around the state. But we have received 15, and probably by tomorrow we will have the list as to where they will be allocated, for lack of a better word. And we do not see that we'll be receiving another batch anytime soon.
And DHEC has reported there's no longer a backlog in testing at its lab, but we also hear about backlogs at private labs. How does it determine where a test goes, whether it be the public lab or a private lab? Who makes that decision and why?
It's a good question. Often it is determined by this location of where the test has been performed. As for an example, some hospitals, some physician offices have contracts with private labs to do their testing. And so they make the choice as to where it goes. And so we have, our lab is available. Our turnaround time is 24 to 48 hours, depends on when we receive the shipment in each day. But some other labs are having longer turnaround times, but it's not our choice as to who sends them to us. It's the choice of the institution or the private entity that is collecting and then shipping the vial or the test kit for testing.
Questions?
Actually, for the National Weather Service guy, you said this is the most severe outbreak in 12 years. We've had a lot of severe weather in South Carolina. Could you describe how this is the most severe?
Sure. We had different types of severe weather parameters of the type that I've only seen once in my career when I was working in Memphis before the super outbreak in April 2011. So that caught our attention days in advance, that we could have long track significant tornadoes, strong tornadoes, potentially violent. And that bore itself out, that we saw tornado tracks of 30 to 50 miles in length across the entire state. It wasn't just one part of the state, it was across the entire state. We also saw significant tornado tracks that still have yet to be surveyed in places like Edisto Beach, Kiowa Island, Litchfield Beach, parts of Horry County. Normally, the ocean protects the immediate beach, the coastal areas, from getting significant tornadoes. Not this time around. And also the fact that we were able to get those strong tornadoes in the pre-dawn hours. That's very impressive. And as I mentioned earlier, that I was very grateful that it didn't occur in the afternoon when we have heating, that we could have had even stronger tornadoes with this type of atmospheric setup. Does that answer your question?
Governor, I know a lot of people right now, like you were saying, are out of work, or their businesses have shut down. As far as rent, are you encouraging homeowners and or folks renting to other people to hold off on charging them rent, or what's the expectation there if they can't pay it?
Well, that's been addressed. The Chief Justice, Don Beatty, of course, has stopped evictions, has issued that order, has also cut down on all the, I think except the most essential trials, most of the courthouses are closed. I don't know that there have been any mandates issued, but we're asking everybody to give those concessions to the extent that you can, because times are tough. This situation is not going to last forever, and we want to pull out of it. We're doing as little damage as we can to people's futures. Yes, sir.
Dr. Traxler, in the news release today, DHEC says we're going to see 2,000 new cases per week through early May. Is this the surge that we all were expecting?
So I think that our projections that have gone up on our website at the end of today go up to just under 2,000 cases per week between now and the end of April and beginning of May, which we do expect to be our peak.
Governor, schools are closed through April 30th. When do you plan to make a decision on whether to keep them longer?
The superintendent and her team and everyone involved are trying to make all of those kind of decisions. None have been made yet, but we'll do them as we have with the others based on all the factors of what the science says, and also the needs of the children, the needs of the teachers, the needs of the parents, and the danger that exists at the time. Any more questions? Well, thank you very much, and we'll see you next time.